Your body is a complex system where each organ plays a vital role, and when one begins to falter, it often sends subtle warning signs weeks before significant damage occurs. Being aware of these signs can help you take timely action and potentially save your health. Each organ communicates distress differently, and recognizing these signals is key to addressing problems before they escalate. The heart, for example, often warns of trouble through persistent chest discomfort. This might not be sharp pain, but rather a feeling of tightness, pressure, or burning. Unexplained fatigue and shortness of breath, even during minimal exertion, can also indicate your heart is struggling to pump blood efficiently. Swelling in the legs, ankles, or feet may signal fluid buildup due to poor circulation, while irregular heartbeats or palpitations are further signs of a heart under stress. These symptoms are often dismissed as minor, but when combined, they suggest underlying cardiovascular issues that need immediate attention. The liver shows its distress through signs like persistent fatigue, nausea, and a loss of appetite. Yellowing of the skin or eyes, known as jaundice, is a key indicator of liver dysfunction, as is dark urine or pale stools. Itchy or dry skin, swelling in the abdomen due to fluid retention, and increased bruising or bleeding from minor injuries also point to liver trouble. These symptoms occur because the liver struggles to filter toxins and produce proteins necessary for bodily functions, and ignoring them can lead to irreversible damage. Your kidneys are another vital organ that sends early warnings before failing. Changes in urination, such as increased frequency, difficulty urinating, or dark and foamy urine, are some of the first signs. Swelling in the hands, feet, or face, persistent fatigue, and unexplained nausea or vomiting often accompany kidney damage. Muscle cramps, itchy skin, and bad breath with a metallic taste can occur due to the buildup of toxins in the bloodstream. Left unchecked, these symptoms can progress to complete kidney failure. The lungs often give subtle clues when they're in trouble. Chronic shortness of breath, even at rest, is one of the earliest indicators of lung damage. Persistent coughing, wheezing, or coughing up blood are also red flags. You might notice chest discomfort, frequent respiratory infections, or a general feeling of tightness in your chest. These symptoms suggest reduced lung capacity and should not be ignored, especially if they worsen over time. The stomach and intestines warn of damage through digestive disturbances like chronic bloating, gas, or diarrhea. Persistent abdominal pain, nausea, or unexplained weight loss can signal conditions like gastritis, ulcers, or even more serious gastrointestinal issues. Blood in the stool or black tarry stools are especially concerning and require immediate medical attention. The brain communicates distress through neurological changes, such as persistent headaches, dizziness, or difficulty concentrating. Memory problems, confusion, or mood swings may also occur. These symptoms might indicate issues like poor blood flow to the brain, neurodegenerative conditions, or even early signs of a stroke. Any sudden or severe neurological changes should be treated as a medical emergency. The pancreas often gives warnings of damage through abdominal pain, particularly in the upper abdomen, that may radiate to the back. Unexplained nausea, vomiting, or a sudden onset of diabetes could also indicate pancreatic issues. If you experience these symptoms, it's crucial to get evaluated promptly. Your thyroid gland shows signs of trouble through unexplained weight changes, either gaining or losing weight without altering your diet. Fatigue, sensitivity to temperature, dry skin, and hair thinning are also indicators of thyroid dysfunction. You may experience mood changes such as anxiety or depression, as well as difficulty concentrating, often referred to as brain fog. The bladder sends warning signs through changes in urination, such as increased urgency, pain while urinating, or blood in the urine. These symptoms can signal infection or damage to the bladder and may lead to more severe urinary tract complications if untreated. Finally, the skin, often overlooked, can signal problems in other organs. Persistent rashes, unusual bruising, or wounds that heal slowly may indicate underlying conditions such as diabetes, liver issues, or immune system disorders. Changes in skin color or texture should be evaluated to rule out systemic problems. Your body is a remarkable communicator, sending early signals when something is wrong. By paying close attention to persistent symptoms like fatigue, pain, swelling, or changes in bodily functions, you can detect organ damage weeks before it becomes severe.